What we want to talk about today is basically to try to give people just a little bit of the basics of what we do with veterinary anesthesia. And it can get very simple, or it can be very simple, or be very, very complex. So many people think, and I guess it's from the old movies and everything, that anesthesia began as a mask and you put it over the patient's mouth and nose, and we do this in veterinary medicine. But it is only one of many techniques that we do use when we anesthetize or provide anesthesia to a pet. The primary things that we start out with is we use medications that not only do they sedate and calm the individual, but they also, as a pre-med, they also help to control pain. Pain is something that is that builds. It actually has a cascade effect where it adds and adds and adds, and it actually gets very, very difficult to control it once it gets to a certain level. So we start even before surgery with pain medication, so that's on board when we do the procedure. With the medications that we use to get them sedated in the initial phases, we also use medications or injections that actually induce them. And when they're induced, basically they're going to be in a state of anesthesia, short term, but long enough in order to pass a tube into their trachea. We intubate these. They're actually passed through the mouth into the trachea itself. The cuffs are blown off to seal it up, and this allows us a port so that we can hook it up to an anesthesia machine. In certain circumstances where we're dealing with an emergency situation where an individual needs anesthesia, I mean immediately, versus maybe needing just oxygen, we use masks. These masks go over the nose and the muzzle of the individual. There are different sizes depending on whether we're dealing with cats or actually we do rabbits and some of the small mammals. And even they do have small tubes and small masks that are used on mammals as small as mice and rats. Birds, there's a whole set of these small tubes that can be used in that. So it's a size-based differentiation of which ones you do need. In some situations, especially when we're dealing with feral cats or animals, primarily cats is where we are under this situation, animals you cannot and really don't want to get injured by some feral cats, then we use a tank. And this tank is very simple. The individual is put in this tank itself. The gas anesthesia is supplied in one end, and then the exhaust is on the other end, so that it absorbs the anesthesia and the byproducts of respiration. When they're sedated and quiet in these tanks, then they're removed from here. They're placed in a mask temporarily, and then we go ahead and pass a tube down their trachea so that we can hook them up to the anesthesia machine. Anesthesia in surgery can be very complicated, and it can also be very simple, but one of the prime things that we've got to keep in mind is those animals must stay warm. We use a electric low voltage type heating pad that is designed where it does not burn the individual but does keep them warm when they're in a surgical procedure. In the surgery situation, when they're under anesthesia, there's very little to no body movement. And so there's no heat that's generated by their body in the movement process. The heating pad is very, very important in keeping these individuals warm enough to get them through the procedure. When they become cold, they don't exchange oxygen very well, and they also don't heal as well. So we want to get them off to the right start. We want to keep them warm before surgery, after surgery, and until they're awake.